Through this course, I have definitely learned a lot about my community and gained a lot of insight. I think that it's important that nurses are familiar with resources that are available in the community, especially things like home health, access, support groups, community centers, etc. These resources can help our patients access the support that they need and improve their health outcomes. Another thing that I think is really important is that nurses in the community consider patients' social determinants, such as their education, poverty, employment, when we're assessing and caring for our patients, because we need to understand kind of their baseline knowledge of their health and if they have the access and support that they need in order to take care of themselves, when they're no longer our patient. Now that I've taken this course, the changes that I'll make as a nurse would be definitely educating my patients. I think that can't be emphasized enough. There are so many people that come into the hospital or into, a doctor's office or wherever they might see a nurse, and they just don't know a lot about their own health. Even if they have been diagnosed with a disease, they oftentimes lack the understanding of how to take care of themselves. And I think that they kind of have the expectation that we'll teach them. And so we need to definitely put in a good amount of effort to make sure that they have the education that they need. They have the resources that they need. They know how to contact whoever they need to contact. I also think that, just cultural sensitivity overall, learning about their patient, my patient's backgrounds, their beliefs and values, and just making sure that I'm, being extra aware of those and conscious of how I take care of them. I do feel like this class definitely increased my knowledge just on community resources. I learned about support groups. I learned where, homeless shelters are, where someone can go if they're experiencing domestic violence. And I also learned how to assess my patients' need for these resources and provide, proper referrals when needed.